Hi, so today our video is on lasers for periodontal use. This is made by Jenna, Dekeukelaere, Ornana, Yako, and Omaira, Hakeemi. I hope you enjoy. So our question we're going to be answering throughout our video is, how do periodontal lasers different from traditional treatment methods? So what exactly are lasers for periodontal use? It's done by a periodontist. The goal overall is to remove bacteria, treat gum disease, generate new healthy gum tissue, and decrease periodontal pockets. The gum tissue that is inflamed around the base of the tooth will be removed with a laser. After the tissue is removed, calculus and plaque that has accumulated subgingivally and around the gum line is removed by scaling and ultrasonic. Then after that, another tool will go in to smooth any rough spots out on the tooth. The healing time after this procedure is a couple days to weeks. Normally, it's 7 to 10 days to be precise. After, the gum will be free from infection with hopes that the gum will tighten back up around the tooth. So next we have a video here, and this will show you how it's exactly done. So next we're going to be talking about some symptoms after laser is completed. There may be a slight shift in the gum tissue color. It might be more red than normal. There will be swelling and minor bleeding surrounding the site, and the teeth may be sore and sensitive for a couple days. And then there also could be a taste alteration. So next we're going to be talking about some advantages. When compared to manual scalpels and other dental instruments, dental laser provides several advantages. These advantages include that the process is overall less painful and invasive than other treatment options. With lasers for periodontal use, unhealthy tissue may be precisely targeted and removed, leaving healthy tissue unaffected. There is less harm to the teeth, tissues, and gums. Stitches are not needed because lasers enhance blood coagulation. This will result in less blood loss and reduced bleeding, and the healing time will overall be quicker. From doing this, there is a reduced risk of infection as a result of the laser killing off bacteria. There is a greater likelihood of tissue regeneration compared to traditional options. This is because the use of laser energy can accelerate tissue regeneration and facilitate recovery. Another advantage is that general anesthetic is not required. Overall, it's been proven that this option is likely for clients to have less dental anxiety, so that is a big advantage. Next, we're going to be talking about some of the disadvantages. Lasers for periodontal use does have a couple of disadvantages. This includes cost. The cost of laser training and equipment can be significant, which could increase the cost of therapy. There is always a small chance of the tooth pulp, and gum damage. Since lasers are being used, the client and clinician also must wear eye protection at all times. Finally, lasers may not be suitable for some individuals, or some forms of periodontal disease may not respond well to laser therapy. And in certain situations, conventional techniques may be more effective for some clients. But in conclusion, with doing this research, it is proving that the advantages definitely outweigh the disadvantages, and this is a great option.
Next, I will be discussing some of the uses today for lasers. First up is a gingivectomy, or removal of extra gingival tissue, and gingivoplasty, which is the reshaping of the gingiva. So these are both procedures that can be performed with lasers. This is frequently done to make the gums look better or to get the tissue ready for restorative operations. Next is periodontal pocket reduction. The goal of laser-assisted pocket reduction treatments is to reduce bacteria and inflammatory tissue from periodontal pockets. This may facilitate the gum's tissue's adhesion to the tooth surface and lessen the pocket depths. Scaling and root planing. To remove bacterial deposits, calculus and plaque biofilm, from the surface of the tooth and its root surfaces, lasers can be used. Scaling and root planing with laser assistance can be more successful and cause the patient less discomfort. Soft tissue biopsy. Lasers can be used to take biopsy samples or to remove soft tissue lesions. Laser's accuracy reduces the likelihood of damaging nearby healthy tissues. Crown lengthening. By removing extra gum tissue, lasers can be used to extend crowns in situations where more of the tooth structure has to be visible for restorative or aesthetic reasons. For example, people with gummy smiles might want to undergo crown lengthening procedures. Frenectomy. A frenum, a tiny tissue fold that joins the tongue, cheek, or lips to the gums, is removed using lasers. This might be done to prepare for orthodontic treatment or to address problems like speech difficulties. Someone with a tongue tie might want to undergo a frenectomy. Treatment of periimplantitis. Dental implants can be affected by periimplantitis, an inflammatory disease that can be treated with lasers. Without harming the implant surface, laser therapy can assist in removing biofilm and diseased tissue from the area surrounding the implant. Photodynamic therapy, the application of lasers in combination with a photosensitizing substance. The antibacterial properties of this approach, which targets and eradicates microorganisms linked to periodontal disorders, are being investigated. Treatment of alveolus ulcers and lesions. By reducing discomfort and accelerating healing, lasers can help people with alveolus ulcers or oral lesions. And lastly, tissue regeneration. The use of lasers can promote tissue regeneration, especially when combined with other regenerative methods. This is particularly important for treatments meant to encourage the regeneration of periodontal ligament and bone.
Future directions. 1 week following up your appointment, a follow-up appointment is advised. The area the, the area will be assessed for healing, and correct brushing and flossing techniques will be reviewed. Healing usually takes place between 7 to 10 days. New innovations of the laser periodontal treatment include reducing future risk of relapsing back into periodontal disease. Fun facts and interesting information. This technique was invented in 1994. It preserves your gum tissue, and it is a lot more cost effective compared to other periodontal treatments. This treatment has little to no pain, bleeding, and inflammation. This treatment also eliminates harmful bacteria compared to other treatments. In conclusion, periodontal laser differs from traditional treatment methods because it is minimally invasive, causes less bleeding, and promotes faster healing and less discomfort. It reduces the need for anesthesia, improves access to deeper pockets. The following page includes all of our references. Thank you so much, and thanks for listening.